Joy, welcome on in. Thank you for joining early. Let me send it out. You guys know what to do. We're grabbing our daily heart meet and we're liking the live. Let me just send it to my guests and then we'll get started. Welcome on in, welcome on in. We are liking the live. Everybody just joining on in. We are liking the live, grabbing a daily heart meet. And once we hit 5K likes, we're going to go ahead and get started. Joshua, what are you doing on here? Aaron, welcome on in. I see you. We're going to start a little bit early today. My guests can't stay too long. So we're going to start off with the guests, and then we're going to get into the trending topic in healthcare. Aaron, you see my new background? I have to switch it up, Aaron. Let me send it out. One sec. Thank you. It's a new year, so I gotta switch it up. But everyone here, we are liking the live. We are grabbing our daily heart meet. Once we hit 5K likes, we're going to go ahead and get started, and we're waiting for our guests to come on up.
You're now listening to an official Oso City mix.
Everybody, welcome on in. We're grabbing our daily heart meet. We are liking the live. Once we hit 5K likes, we're going to go ahead and get started. Ashante, I see you. Thank you so much for liking the live.
Remember that girl. Tell me what you wanna, what you really wanna do. Tell me, baby girl, if your love is really true. Tell me what you wanna, what you really wanna do. Tell me, baby girl, hey, I know I'm in line up. Yo, if you really love me, let it flow. And if you don't love me, let me go. But in the road, where I let you know that. Baby, we're going sometime. I don't know how you believe it. It's not the girl. beat in the street. You see, I get nothing. The whole of them girls, they want to be our friend. And you me really love, why you want it to end? You have me brains a puzzle, they can't comprehend. But then again, everyone does need love sometimes. Oh, no, no. I don't know you, but we need a kind. Everyone does need love sometimes. I don't know you, but we need a kind. Hey, you want to tell us something, girl? You want to tell us something? Bitch, do you wanna this? You wanna miss? I will start up a brand new relationship. I'm gonna flex like witch, lock her off like switch. If you disrespect me, dump you like rubble. Do you wanna miss? Do you wanna this? Then I will start up a brand new relationship. I'm gonna flex like witch, lock her off like switch. Well, if you listen to this, well, road boy, anyway you see her, tell her to see fall. You wanna rock home, come me have a little star. No, she have a bad man round her back wall. And you see down and you a ball. No, you go so to be a young gal a call. No more headache anytime the rain fall. In a love life you have to be comfortable. Here come the things called what? Do you want this? Do you want this? Never start up a brand new relationship. I'm gonna flex like witch, cut her off like switch. If you disrespect me, don't you like rubbish? Do you want this? You want this? Then I will start up a brand new relationship. I'm gonna flex like witch, cut her off like switch. But if you listen to this, show me no illegal demo, when everything demo. Oh man, don't go from head to toe, up close and personal. Get enough attention. Can I know all man want me to go? Me no illegal demo, when everything demo. Oh man, don't go from head to toe, up close and personal. Get enough attention.
Everybody, welcome on in. We're just getting started. Blessed believer, I see you. Welcome on in. We're getting the live to 5K likes. We're grabbing a daily heart me, and then we're gonna go ahead and get started. Good evening, blessed believer. Happy New Year. How have you been? Let me make sure I send it out to the guests. Hold on. Holding strong, that's all you gotta do, hold strong. We are today maybe a little bit maybe a little bit early. Our guests can't stay too long, so we're gonna see how this is gonna go today. But today won't be a long office hours. Before I get started. Dr. Henry, welcome on in. I see you. We're just getting started. Haliku, I see you. Welcome on in. We're just getting started. We are grabbing the live. We're grabbing our daily harmony and liking the live once we get started. Okay. Haliku, thank you so much. Thank you for grabbing your daily heart me. Dr. Henry, thank you so much for liking the live. My guest is here. I know she is pressed for time, so I think we're going to do things a little bit different today. We're going to bring up my guest first because I'm not sure how much time she has. So I just send the invite to our guest. Haliku said, "Is this the dance portion?"
Hi, can you hear me and see me?
Yes, ma'am. We can hear you, but we can't see you.
Let me see if I can. Okay, my camera was. All right, there we go. Hello. Oh, still can't see me, right?
Still can't see you, not yet. I think you have to press save.
Okay, I got it.
Everybody, we're doing office hours with Dr. Johnson a little bit different today. Where guests can't stay too long. Pals, Chief of Staff, welcome on in. Okay, Brain Whisperer, I see you. Can we thumbs up in the chat if the audio is good? Thumbs up in the chat if the audio is good. Okay, the chat is saying welcome. Okay, perfect. Thank everybody.
Good. Oh, thank you.
Perfect. Okay, I can hear you. They can hear you too.
Awesome. Good,
Perfect.
good.
Okay. Brain Whisperer, welcome on in. Thank you so much for taking the time to step into office hours with Dr. Johnson. We've been planning this for a while.
Yes.
I found your page on the FYP, and I always like to connect with other people of color, especially within my same niche, which is healthcare. So thank you so much for taking the time out of your busy schedule. You told me you don't have all day. Normally in office hours, I do a trending topic in healthcare. Then the segment 2 is my interview, and then I wrap it up with some professor tips. So guess what? It's the new year. We doing a lot of things. I already told them no, we can't stay too long, so we're just going to jump right into the interview.
Okay.
Obviously this is social media, so whatever you don't feel comfortable sharing, you already know what it is. We're used to following HIPAA, so whatever name you don't feel comfortable sharing, you can kind of give context clues. But to start off, can you just hit us with your professional and educational background?
Sure. My name is Amoya. I am a psychiatric mental health nurse practitioner. That's what I do. That is me. I am mastered prepared. So I did a bachelor's to get my BSN. You sit for the NCLEX, become a registered nurse. I worked for about, let's say, like 3.5 years. I did oncology and psychiatry. I would work during the day at a major hospital here in Atlanta on the oncology unit. And then at night, I would work at an inpatient psych facility. And I did that for a little bit. Then I decided to go back to school and got my master's at Georgia Southern. And yeah, I've been practicing. I was with a company for about 3 years after I graduated with my master's. I passed my board for my master's, my psych NP, and then I started my own practice. It's been about 2 years now. So yeah, it's been a journey, but that's a little bit about my background professionally and what I do in healthcare.
I love that. Thank you so much for sharing that. I want to jump right into it because I do have a couple of questions prepared because everybody knows Dr. Johnson does his homework. Can I have this one person drop the sticker, Dr. Johnson does his homework? Let me ask you something. What inspired you to become a nurse practitioner instead of another healthcare role? What was it for you?
Sure. Now, my background, Nigerian education is like
Yeah.
100%, like that is the emphasis. They don't care
Right.
about anything else. It's your brain and what you can do with your brain. So my family actually, my parents had the dream of me becoming a physician,
Okay.
and which is great. I love my physicians. They definitely have their role in healthcare, and of course, they're immense value. However, my brother had gotten sick, and this was like a medical illness. He had gotten sick, and I really, you say, oh, you want to be a doctor, you want to be whatever, a lawyer. You don't really know until you maybe get into a situation where you actually are able to experience what that role looks like. And I noticed that it was the nurses that were coming in, checking on my brother, the doctors, and understandably so, they're very, very busy. They have, a lot of patients. Nurses have a group of patients. So I understand that they're busy. So they'll just come pop in, make sure they're doing okay. They put the orders in on the back end, and you go from there. But it's really the nurses that really will come in, take care, get to know the person as a whole human versus just that disease process. So I saw that and I was like, yeah, I'm pretty sure what I thought a doctor was is actually what a nurse does. So yeah, exactly. So I was like, okay, maybe, that's what made me go the nursing route. Then I was a little bit young, and funny enough, nurse practitioners, it was a thing then, but it wasn't as like known as it is now. So then I figured out that there's a career path where you can actually get an advanced practice degree, be able to prescribe, be able to basically like combine the best of both worlds, where you're still a provider, but still able to function in a role of nurse where you're taking care of the patient holistically. And I was like, yeah, like there's nothing else that I want to do. Nothing else.
I love that. And thank you for shedding light on nurses. We're not taking away from physicians and
No,
MDs.
not at all.
Not at all, never. But nurses do sometimes do twice the amount of work.
Oh, yes.
Twice the
Oh,
amount of work.
yes.
So thank you so much for shedding light on that.
Yeah.
What certifications and licensure were required for your specialty? Now, you said you were a psychiatric mental health nurse practitioner. I'm sure not all nurse practitioners go through the same licensure or certification process. Can you kind of walk us through that?
Yeah. So of course you have to become a registered nurse, a BSN prepared registered nurse. With registered nursing, there's two pathways. You can be an associate ADN, which is, I believe you go to school for like 2 years, 2 to 3 years. You can get associates, and then your bachelor's is like an actual bachelor's degree program, and that will allow you to go forth, and then you're able to apply to a master's program. So that has to be like foundation. Some programs don't make you get experience as a nurse. That's program specific. I always advise it because how will you know how to take care of a fundamental, no, that's just that fundamental basic of taking care of a patient. You need to know that, and you'll experience that once you get in the field and actually do the work. And then once you experience that for a couple years, and you can go back to your master's program and then, get certified as an advanced practice nurse practitioner. So once get some years of experience, like I said, not all schools require it, but I advise it just so you can understand exactly a patient presenting is different from a textbook. So that's always important. And then you go back to school for your master's. I believe master's programs are 2 to 3 years from what I'm seeing. Mine was nearly 4 years just based on my program structure. So I went back to school for that. And then you sit for a board exam for the bachelor's for a registered nurse to get that licensure, and then you sit again for another board exam to become, after you do your schooling for your master's with a concentration in psychiatric mental health, you sit for another board exam to certify you in that specialty specifically. So that's how we got here.
I love that. Thank you for sharing. I always discuss everybody has a different journey, and I'm an advocate for higher education. I'm an advocate. Hey, go to school. If we could do it, you can do it too. And representation is so important. So whenever I interview people, I always want them to kind of share, what was your journey? What was that like? Give it to us raw. You know how it's really going to be. I want to continue because I know you pressed for time, ma'am.
No worries.
Don't want to waste your time.
No worries.
But what were some of your biggest challenges you faced during nurse practitioner school? Let's take it later.
Biggest challenges. Okay, so I will say that back to my parents have always been very, very supportive. They helped me up until the extent of my bachelor's. They took care of that degree. I'm so grateful because I know not everybody has that level of support. I understand that. I did not know how much work it would be to be working full time and going to school full time. That was a struggle. That really, really did humble me in terms of like, dang, people that are in these places where they're able to obtain a degree like that, an advanced degree, they're either coming from a very wealthy background or they're taking out a bunch of loans, whatever that looks like. But you really do, for even the loans aside, to even survive while you're in school, getting that degree, balancing that, when you're, 18, 19, you still are kind of a baby. You're still under your parents' wing. But once get past that and you have to fend for yourself and learn how to balance, and you've never really had to juggle all these things at once, be a good student, take tests, go to work, you're clocking in. I would work overnight sometimes, just finding that balance. That I would say was the hardest part for me. My last semester of my master's program, I got pregnant with my daughter. So I graduated May. I got pregnant with her. I gave birth to her February, 3 months. In that 3 months, I told myself, had I had this child any sooner, I wouldn't have been where I was. There was no way, because I don't like women who go to school and have kids. That's a different level of, I don't understand it. I know I couldn't do it because even that 3 months almost took me out. So just dealing with like being an adult and going through school and having all these moving pieces and still saying, we have a vision, we have a goal, we have to make it. I would say that was my hardest part about getting to my master's. That's 100% the hardest part.
Thank you so much for being so transparent and sharing. I have a couple questions, different subtopics that I want to run through, but I do have a couple of people here in the chat that mental health, we always discuss a variety of topics within mental health, okay? And specifically when it comes to ADD or ADHD, with your psychiatric mental health background, what would you say to an adult who is diagnosed with ADHD and they want to, I don't want to say overcome it, because it takes a journey. Everyone's mental health journey is not the same, and it takes a process. For those who are suffering, I don't even know if I want to say the word suffering, because I know a lot of successful people who are thriving with their ADHD. So I want to make sure I choose my words wisely. But with those adults who are diagnosed with ADHD,
Hmm.
what would you recommend for them to continue being well, for them to continue being productive? How can they go about it? You
Hmm.
know, let's start.
ADHD specifically,
Mm-hmm.
this is something that people are born with. This is a neurodevelopmental disorder
Mm-hmm.
that you would have struggled with your entire life.
Mm-hmm.
Just because you become an adult, a lot of times the emphasis, oh, this child, this little boy has ADHD, we need to medicate, whatever that looks like. Just because you become an adult doesn't mean that those symptoms go away.
Mm.
Especially in our community, sometimes it's overlooked. It's seen as something else, it's labeled as something different.
Right.
And it doesn't mean that just because we reach 21, 25, and our brain should be developed now, that those go away. So in terms of ADHD specifically, if it's non-pharmacological, structure, a routine, schedule, writing things down. You can't just, free ball life. You have to have structure every day. Even the day before, you have to really take the time in your schedule to sit down and plan out exactly how you want your day to go. And in saying that, you set reminders, you set timers. People that have ADHD, it's very, very easy that time passes them by very quickly. They'll be working on something, they think it's 5 minutes and 5 hours have passed.
Right.
I have patients that I treat that are like this. So it's very, very important to set timers, to set reminders. Put yourself in a position where you make things easy. If you know a certain task is dreadful, don't put on your schedule that you're going to spend 2 hours on this. Spend 10 minutes on it if you're able to. Let's say it's something that isn't even like folding a pile of laundry. Let's say you do your laundry and everything, and you have a pile that you need to fold. Do 10 pieces a day. You don't have to do everything. Just do 10 pieces. Just know today I'm going to spend these 5 minutes to do 10 pieces. And it's going to get smaller and smaller and smaller, the load, until it's no longer there and you've accomplished that task. You do things like that in order to manage life and take life in smaller pieces. So it's the schedule, it's the routine, it's taking life in bite size and doing things that based on your attention and your focus, that you are able to really, really be successful in that. That's the biggest thing. With ADHD, life still goes on. So, and it's hard. This is something that's very, very hard. Imagine having that going on. Your mind is going 1,000 miles per second and you still have to function through life. It's very difficult. So having that structure and knowing that you have a guide to each and every day, that's what I recommend. Obviously, I'm a prescriber. I'm also going to say that if you can manage it with medications, I'm 100% for medications being used as a tool because they are available. We've gotten very far in science, so we should be able to use what will help us. There's no need for us to suffer more than we have to. But if you're somebody that doesn't like to maybe be on medication, or you have your views on that, whatever that looks like for you, definitely that structure piece is critical.
I love it. Thank you so much for sharing that. That was going to be my next follow-up question. Medication.
Sure.
You nailed it. Subject matter expert. Can I just have the two persons in the chat drop subject matter expert? Everybody joining on in, welcome. I am interviewing Nurse Practitioner and Big CEO, the Brain Whisperer. She doesn't have a lot of time today, so we're going to rush through her interview. Let me ask you something. What would you say to those who have ADHD or ADD and feel as though there is something wrong with them?
Yeah.
Words of encouragement from your psychiatric experience. What would you share to said person?
Yeah. So I just want to validate it and say that there is absolutely nothing wrong with you.
Mm-hmm.
Just like when patients have blood pressure issues, just like when you have a diabetic patient, of course, these are numbers that you can see. You can see a blood pressure is high. You can see that the value on the glucometer, it's a higher number. ADHD, unfortunately, psychiatric disease, a lot of times you cannot see it. Your brain is not working in the way it's supposed to. So it's not like, oh, there's something abnormal about you. Your brain just works differently. Your brain just works differently, and you have to accommodate the type of brain that you have. So it's not necessarily that there's something wrong with you. It's just that you have to do things differently, and you have to take life. Maybe you can't, do life the way your friend does or do life the way your brother does. You have a different brain, so you have to make those accommodations. People with ADHD, most of my patients with ADHD are very, very successful, extraordinarily successful.
That's why you saw I chose my words wisely earlier. Yeah. I know a lot of people who are successful and thriving, but they suffer with that in silence,
Yeah. Yeah. Because with ADHD, you're working 10 times harder. You have to work 10 times harder. And that natural work ethic, although of course it can come to detriment sometimes, but a lot of times it'll work for you, but it also puts you at risk for exhaustion. So you have to be really, really careful. And it kind of goes back to the medication thing. If you know that you are a person that you have to put in like 10, 15 times more than person A does, really understand about yourself and get the help that you need, because there definitely is support there.
Thank you so much for sharing. Like everybody just joining on in, welcome to Office Hours with Dr. Johnson, the first office hours for 2026. Today we are interviewing the Brain Whisperer. She's a psychiatric mental health nurse practitioner. And we're just going through my questions. Everybody welcome on in. I don't know, you haven't been here before, but if you see me doing a thumbs up, that's me acknowledging them in the chat. I don't want to be ignoring them. Okay, so the thumbs up is
No
not,
worries.
I'm not rushing you. I'm talking to my people. They know what's going on.
Got
So I
you.
want to continue. I'm big on cultural diversity. I'm big on cultural competency. I did part of my dissertation on that, and I created an educational product around cultural competency for healthcare professionals. I'm Black, you're Black.
Yes.
We're both in healthcare.
Oh, yeah.
You can kind of see where I'm going with the next topic, but how do you ensure culturally competent care for patients from different backgrounds as it relates to you being a psychiatric mental health nurse practitioner and having your own clinic?
Yes. You ask. You ask. If you are not sure about something, that patient, whoever is sitting in front of you, will appreciate it so much more if you just ask. Everybody that is dark skinned, a lot of times, maybe you don't know where they're coming from. You have no idea. Being Black, you can be from a Hispanic background. You can be from the Caribbean background. You can be, from, the motherland and everything. Ask. Don't assume. Just because you taking care of a patient that looks this way before, you have no idea what background this person is. And don't assume. Another thing is, when somebody is speaking to you and maybe you don't understand something, ask them what they mean. Like, I know this is going to sound so crazy, but if somebody says, oh, I'm going to blow this bathroom up, some people will take that and be like, oh, that's a threat. And in some culture, that means they're gonna, they've had a bowel movement and it smells horrible. Make sure you understand what that patient is saying, because then you can put in your notes that, oh, this patient is having, homicidal ideation, when it's just a cultural thing. So you see how it can get very, very dangerous. So it's very, very important to ask questions. If a patient says something that maybe you don't understand, ask them, what does that mean for you? What do you mean by this? That's the biggest thing that I would say. Asking questions have saved me, because even me, sometimes I don't understand certain things. I'll be like, okay, so what does this mean? Just because it's new to you and it's not within normal limits for you does not mean that that's not normal for that person or what that person is used to. So we need to be very, very careful about what we make a disease or what we say, oh, this is not correct, just because we don't understand it. So that's when you make things more patient-centered versus, just taking your own background and applying that into the patient's life. That's what I would say about cultural competency, is just to ask questions and figure out what it means for the patients.
I love that. Thank you for breaking that down. I want to stay on this topic one more. What training or experience best prepares you to work among diverse patient populations?
What training allows you to, or any experience? I would definitely say, I honestly will say how you show up on your day-to-day life in community and who you interact with. If you are somebody that isolates yourself or maybe just sticks around people that do the same things as you, or maybe, not everybody has the opportunity to travel, but if all you know is your immediate surrounding area, you're going to automatically think that this is how life should go when there's such a bigger world around you. So putting yourself in the position to interact with people from different walks of life, I would say that that's the biggest thing. Of course, you can read in a textbook how to be culturally competent, which is fine. I think those books are great guides, but we are in a world that is ever changing, is ever evolving. We have different things. Kids come up with new lingo. So we have to be, we have to stay on top of that and make sure that we're staying current and making sure that we're not assuming anything. And I would say just your lived experience, try your best to interact with people that might not necessarily live life the way you do or look like you. To be honest, that's what would save me. I am from Colorado, so a lot of times people did not look like me. I was the only Black person in my graduating class. So I really, really saw, a lot of ignorance when it comes to people interacting with you, making the assumptions. They have no idea about your life, your upbringing. They just assume based off what they see on TV or how they think they should talk about you. I don't know. But yeah, definitely putting yourself in a position where you expose yourself to maybe backgrounds and different type of experiences that maybe you don't get to experience in your immediate circle.
Right. Thank you so much for sharing that. I want to continue.
Yeah.
Now I know you have your own practice, and I know you sell it how to open that own practice. So we're gonna touch on that subject, properly. But
Sure.
what motivated you to open your own private practice rather than working for a big hospital or a big major clinic? I'm sure you've worked at a clinic or hospital in the past, but what
Mhm.
motivated you to be your own boss, be your own CEO, and open your own practice?
Sure. I will say I'll be very
Be
transparent.
transparent. They love the transparency.
Yeah, becoming a mother.
Oh
Becoming a mother. And I know that sounds so cliche.
no! Everybody lean in. Can I get
Yeah.
can I one or two persons just drop lean in? Can
Yeah.
everybody lean in? She's about to drop a gem.
Yeah.
Becoming a
Becoming a
mother.
mother. With our babies, they're small for such a limited amount of time. And you tell me that I only have 12 weeks to spend with this child that is only going to be this small for this amount of time. And I have to go back to work to take care of other people when I myself, I'm not even all the way healed from giving birth. And you're telling me this is what I have to do in order to survive, in order to live. I know I have a skill set that is valuable. I know I have a skill set that people need. So it was a hard decision. And I stayed part time for a very, very long time. But once I saw that it was doable and I had that push, especially the thought of me, having to leave my newborn, I said, well, at that point, they were about like 2.5 months, like that. And something inside me was like, I have to do it, pushed me to figure the process out because my practice, I had nobody guiding me. I did my research. It was from the ground up. That's how I built my practice. So it was really from that motivation to just not have to go back to a job in order to survive. That is really what pushed me. And that came from being a mom. I was like, this child needs me. I mean, if I was single, I'll go and work however many hours. I traveled, nurse, I did everything. But then when it comes down to it, what really matters, the days that we have with our children being so small. And they only stay that small for 1 year. And that year is so critical. Not talk less of like breastfeeding and being there. They can't hold their head up straight. Nobody takes care of their child like the mom does. And that's just facts. Of course, dads are there. We love our dads, but that bond that mothers have with that child, you don't want to miss it. And I wasn't willing to give up that bond to go and work for somebody. It wasn't worth my time to me. I rather spend my time with my child. So honestly, that is what drove me to open my own practice. I saved. I knew that, as I was pregnant and everything, it would take me a lot to save and be very disciplined and maybe cut out some things. But that's what birthed that practice. That was the fire behind it. That's what drove that.
I love it. Thank you for sharing that, and thank you so much for being so transparent. I just want to stay on the topic of being transparent, but were there any legal, financial, or administrative challenges you faced in opening your private practice? Because I know I have a lot of subject matter experts who are big on being their own boss and opening their own business. But obviously, share what you feel comfortable sharing. But were there any legal, financial, or administrative challenges you faced in opening up your psychiatric mental health clinic?
Sure. Now, in the state of Georgia, that's where I live. It is very restricted. Nurse practitioners, it's when you're able to practice independently, like without the supervision of a physician, it's called full practice authority. Georgia, out of all the 50 states, Georgia and Texas probably have the most restricted rules that you have to, follow the guidelines by. That is what I will say was the hardest thing. It's okay now because we figured it out. Was the hardest thing in opening my practice is navigating those laws and those rules, meeting with lawyers to make sure I was doing everything compliant. You're not making any money. So where do you get the money to pay these lawyers and everything? And their fee is no less than like $500 for 1 hour. It was crazy, but we figured it out and everything. And of course, opening a practice as a nurse practitioner, let's call a spade a spade. Not everybody views nurse practitioners as they would a physician.
Okay.
So it's a lot of building that trust, especially in the community, your referral partners, building your practice, because you have to have patients in order for you to have a practice. If you don't have the patients, you don't have a practice. So building that trust in the community, getting referral sources to refer to you. They've had their referral sources since from time. They've been doing this for forever. So they have the people that they're comfortable with. So you have to now break into that and say, hey, I'm a new player in the game. Refer to me. So that's what I would say was the biggest thing. But obviously, what helps with that is, I'm naturally very extroverted. I like to get to know people. I will tell you what I'm doing. And I told everybody about my practice. There was nobody that, had ears that did not know about my practice. But then, little by little, people knew my name. They knew that I provided good care, and they would send over the patients to me. So building the practice, trusting God that, hey, I have 2 patients on my schedule this week, but next week I'm trusting you for 10 or something. So, I was even looking at it because I opened my practice in 2023. I looked back just to see how much the growth. I had so many white spots on my schedule. Now you look at it, there's no space to put any patients. So just that build and trusting and not giving up and, working around the regulations. Yes, they said that you can't do this, but you can do this. You can work around it this. Yes, it might look a little bit different, but at least you can get around it. So just having that, motivation to work through all those issues. Don't get intimidated. It's very easy to work for somebody. Working for somebody is easy. I know what I mean when I say that. When you bet on yourself, when you say it is me or me, and all you have is to fall on yourself, you're going to make it work versus, you can go and get a job, work for somebody else. When you have to bet on yourself and you know that people are relying on you, you make it work for sure.
Thank you. So this was a great segue to the next question. Having faith, because it sounds like you had faith in yourself, because you had no other plan but to have faith in you. You had said earlier on that you're Nigerian, I'm Jamaican, Caribbean. We're Caribbean and African, okay? And
Of
obviously,
course.
religion is big in our culture overall,
Yes.
I always have this conversation. I recently had this conversation at a conference I hosted, but I just want to continue having this conversation because even if just one person needs to hear this, hear it, okay? So with that being said, religion being in our background, being heavily in our background, what would you say to those who want to pray all the way? Their mental health issues or their mental health concerns, they just want to pray it all the way and give it all to God. Me and the people who I brought together, we all said, hey, you got to put in the work as well too. From your clinical background, from your cultural background, from your Nigerian background, okay?
Yeah.
What would you say to said person? Yes, it's good to have faith. Yeah, we can have faith, but you got to put in the work.
Absolutely. Absolutely. So of course, being Christian, first of all, believing in Jesus as our Lord and Savior, we believe in the promises that He says. Add on top of that, I'm Nigerian. We're getting a tiny bit better when it comes to mental health, like a little bit better, a little bit, but we're still very, very far behind compared to the United States,
Thank
of
you
course.
for saying that.
Yeah.
Thank you for saying that. Because to this day, they're still saying, you need to go pray. Something's wrong with you. Go pray.
Yep. It's very true. Very true. And, of course, we can get into certain things. Obviously, prayer is the answer. Nobody's taken away from that. There are certain situations that prayer works. I'm not saying that prayer doesn't work.
Exactly.
But faith without work is dead. We have to remember that. We have to remember that if you have been put in a position, you have access to mental health care, you have therapists around you, you have things that will help manage your symptoms, and you are saying that, oh, you're not going to do that, though we have these tools that God has put in front of you to help you, and you just want to pray it. Nobody's saying nothing is wrong with prayer. You do both. You say, God, I'm going to take this Lexapro. I'm praying that this depression gets managed. I'm praying that this is something that can stabilize. And then one day, maybe I don't have to take it anymore. But for now, I'm feeling this way. I know it's affecting my my ability to function. I need this because if I don't take this, I can decompensate even further, and I'll end up in a hospital, and then, you can't do anything at that point. You're at the hands of whatever the hospital says. But knowing that you have a tool that you can use along with prayer, along with your faith, because that's also a component of it too. But sometimes we're dealing with chemical imbalances.
Hey,
Sometimes the fix is just take this medication, let things regulate, get into a place where your body can actually receive the therapy, get into a place where your brain can actually comprehend what's going on and start to heal itself. But if your brain chemistry is not even at a place to even do so, it's very, very difficult to just pray it away. Yes, prayer works, but God wants to see you also using the tools that you have, especially if He has put it in front of you, especially if you have the resources to do so. So, yeah. And culturally, we're Nigerian. I'll say this as daughters of an immigrant, I was born here. So I will say that the things that my dad will like tell me that he went through and everything, even back home, and I'm not going to front, I'm not saying that, we were poor or whatever.
right,
We were okay. We were pretty okay, but they still struggled.
right.
They still struggled. The people will say like they don't have time to think about their mental health. They're just trying to make money and survive. So how can they even think about their mental health when if they turn on the lights, it might not come on sometimes, So they're thinking about different things. And then, when you come here and then, everything works, everything's in a good place, the government supports you, everything is pretty cool. People think that once you have those immediate needs met and all you are left with is your thoughts, and you realize that those thoughts are not healthy thoughts, you have to do something about it. At that point that there's no excuse. So yeah, that's what I would say. So the religious components, the cultural component, trust me, I work with a lot of patients. I will confidently say that most cultures outside of American culture has some type of, and American culture still has the stigma, but I will say almost every culture has some, like an even more severe stigma when it comes to mental health. It's not just people that look like us, Caribbeans, Africans, Hispanic culture,
Yep.
European, there's a Russian lady that I work with.
Mhm.
And the same thing, they're we don't have time to think about this. What do you mean anxiety? This is just how I am. And they normalize it and everything. And then the blood pressure gets affected because they're so stressed. So a lot of times that stigma is there just culturally in general. So, when we are interacting with, people from different walks of life, we really have to understand that cultural piece will a lot of times make them minimize what they're actually going through. So when somebody that is of, a certain background comes to me and says, hey, I'm not feeling good, that is a red flag. They really are in a very bad place because culturally, that's not something that they would just do on their own. So, yeah.
Thank you so much for sharing that. Everybody is just turning on, and we're interviewing the brain whisperer, psychiatric mental health nurse practitioner. And I know you are pressed for time. Let's have a couple more questions. We still going to
Sure.
talk, right?
No, yeah, that's fine. Mm-hmm.
Okay. Advice to current students. What would you say to those who are interested in nursing and not sure what path to go? Because just like healthcare administration is broad, so is nursing. What advice as a current nurse and a nurse practitioner, seasoned nurse practitioner with your own clinic, what advice would you give to current nursing students who are unsure about where to go and what route to take?
Sure. What I would say is, just on the baseline, focus and finish.
Mhm.
It's not easy, but it is worth it. That's the first thing I'll say to my ladies. Don't get pregnant.
Okay.
Once you get pregnant, it is tough to finish school. So if you're young, you don't have a child, try to do everything you can to focus on your education and really just try to finish. That's number one. Now, in terms of finding a, specialty or what your niche will be while, once you become a nurse, I will say that because nursing is so diverse, you should do what you love first. If you think that you love working with children, pay attention very, very closely in your pediatric rotation. Really stay close to what those nurses are doing and pay attention to how your we call them preceptors, what your preceptor does on day to day. Some people will say they love children, but they don't realize a sick child is very different from a healthy child. They might not really like it. So, and I used to be like that. I thought, oh, I'm going to work with kids. I love kids. I don't like kids. I don't like sick kids. That I can't do. So you have to maybe put yourself in these positions and take opportunities. If you have an opportunity to shadow somebody, go and do it. If you have an opportunity to possibly, maybe work as a CNA. A CNA is a certified nursing assistant. That's like where you assist the nurses with their day-to-day whatever. Take an opportunity and work in that setting that you envision yourself being a nurse in, and see if that's something that you actually like. A lot of times people have perceptions of what something is, and then when they actually start doing the work, they're like, okay, this is not really what I thought it would be. I started off in oncology, and it's so crazy because I never thought I would be anything with oncology. But when you work with those patients and you see how the gratitude and how grateful they are to even have the opportunity to be alive and work with you. I was like, medically, if I had to go back and like do life again, or like go through and work in a medical setting again, in terms of like physical, I would do oncology. I would do cancer. And I didn't know that until I did my rotation in nursing school on oncology. And I'm like, wow, this is what I like to do. So that's what I would say. Take the opportunities that you can and really experience it. Also know that a lot of time I'm getting a little bit like specific here. If there's any nurses on the call, you know what I'm talking about. A lot of times you'll hear older nurses saying, hey, you need to start off in med surg. Med surg is like general, like everybody comes on med surg. They'll say start on med surg, don't specialize. I will say specialize in what you love, because nursing is so diverse. Med surg will always be there. Med surg will always be there for the patients. You will always have the opportunity to work med surg. There's no shortage of med surg jobs. That's why I encourage, especially nurses that look like me, go into the specialties. Go into the ICU, go into the CVICU, go into peds, go into labor and delivery, because they need nurses that look like us here. They need nurses that look like us, because, with the maternal mortality rates, they need Black nurses to advocate from them. We're not able to do that unless we're in those spaces. There's no opportunity so if we are not willing to take a chance and try to apply to those areas, then we don't have the opportunity to ever know if we could be in there. So I would say go for what you love. If you think you want to be labor and delivery, if you have the opportunity to do your preceptorship and do your clinical hours there, take that opportunity every single time, even if it means coming off on an off day, even if it means you have to go in on a weekend. Take those opportunities and apply for residency, nurse residency. Like once you graduate, apply for nurse residency in a specialty that you want, not med surg. A lot of older nurses are going to say, oh, do med surg. That's older way of thinking. Do what you love from the onset, because what will happen is that will help you not burn out, because if you're doing what you hate, you're going to burn out very quickly, and you're going to think that is all of nursing, and it's not. Nursing is so diverse, so versatile. If you don't like one thing, you can train for something else. So it's very, very forgiving as well too, in terms of how you can move around. So that's what I would advise.
I love it. Thank you so much for sharing that. Everybody just joining on in, welcome. We are interviewing psychiatric mental health nurse practitioner, the brain whisperer. I have 3 last questions for her.
Sure.
What have you enjoyed the most about having your own mental health clinic, being your own CEO? You have the years of experience, working for the man, but what do you enjoy the most with being your own CEO of a mental health clinic?
Yeah, I love the time that I can spend with my patients.
Okay.
I love not feeling rushed. When I was working at a clinic, you have like 25 patients that you need to see. You have 8 hours to see them. It's impossible to do this without rushing, without saying, okay, what's up? You're not feeling good. You need a medication increase. Okay, cool. Next patient. It's like a revolving door, and you still have to document. You still have to send medication. You still have to answer phone calls. I enjoy the fact that I can see maybe 10 patients a day. I can spend 30, 40 minutes with a patient at a time, understand what's going on. I build that rapport. I'm able to understand my patient as a person, not just somebody coming in to get medications. So that autonomy, that the authority that I have to just see the patient and spend as much time as I want. If I want to book out an 8-hour slot and see one patient, I can do it. So it's just I can do it if I want to. Just to have that freedom and that level of flexibility, I absolutely love that piece. I can practice exactly how I want to. Of course, use evidence-based guidelines. You're just not free balling their treatment, but it's just that time to understand a complete story. Having that time, like, oh, I'm feeling sad. Yeah, you're feeling sad, but you've had this, and this happen to you, and you're able to connect the dots a little bit more because you have the time to actually connect the dots versus just hearing a piece of it and missing the complete picture. So that's what I like personally.
I love that. Thank you for sharing that. Now we're talking about all this mental health this and mental health that.
Mhm.
What does the brain whisperer do to stay on top of her mental health?
Sure. Okay. I am a traveler. I travel. Of course, I had a son 10 months ago, so we haven't really traveled too much. This year, this and last year, this year we're going to travel a little bit more. I love traveling. I'm a big self-care girly. I get massages. I get my nails done. I'm on a fitness journey. I'm trying to a fitness lifestyle adjustment. It's a lifestyle modification. So I try to cook really good food. And I put blocks in my calendar. I'm not afraid like to say, okay, on this Tuesday, I'm probably going to stop seeing patients by 1 p.m. and then just use the rest of the time, either, do something in my house, cook a meal or something. I am frequently putting blocks in my schedule just to focus on myself. I have very tiny children. My oldest is very small, less than 5, and I have 3 children less than 5 years old. So I'm very, very busy. Yeah, I'm very, very busy with them. So I try to get my self-care in where I can.
I love that. Thank you so much for
Yeah.
sharing that. Last question. What
Yes.
is your overall why as it relates to the work that you do, as it relates to the reason that you continue showing up for the work that you do? What is your overall why?
Yeah. So it's so funny because I was thinking about this. My why is because, and this is going to sound a little bit crazy and maybe probably really corny, but my dad went through hell to
Mm,
get to where he was and to give us the life that we have.
mhm.
It will be a shame if I won't say it's been easy, but he really set us up for success. It would be a shame
Mhm.
if I spent the time in my life, the years on this earth, and I didn't make something iconic of myself. It
Okay.
would be a shame. So, and of course my kids is a part of it as well too. I love my babies. I want to give them a good life. I want them not to have to worry about anything. Of course I'm not going to spoil them. They're going to have to get things on their own too, but I want them to be comfortable as well too. But really my why is somebody really suffered for me to do this. So you have to make something phenomenal out of yourself. That's what I would say my why is.
I love that. Thank you so much for that.
Mhm.
And I can definitely relate to that too, because even
Yeah.
though I was born here, but I went to school back in Jamaica, I grew up back in Jamaica. My parents and my grandparents fought for us to live the American dream. So for
Yep.
every day, my dad does not call me Anthony. He says Dr. Johnson. Every single moment he can get to say Dr. Johnson, he will. So don't ever think
Yes.
why I was corny, because Dr. Johnson right here can definitely relate.
Yeah.
I'm living the American dream. I'm living what my grandparents and parents prayed
I'm
for.
telling you. Yes.
Thank you so much for sharing that, okay?
Absolutely. Absolutely.
I know you're pressed for time. Thank you so much for taking the time to step into office
Of
hours, Dr.
course.
Johnson. We're definitely going to keep in touch. I do office
Absolutely.
hours every Tuesday, but I also host a monthly conferences. So I love to bring people back to, kind of share their subject matter expertise. So we'll definitely keep in touch, okay?
Absolutely. I'll be glad to. Thank you so much for having me. Thank you for all the love. I couldn't keep up with the comments. There's so much interaction going on. Thank you guys so much. I wish you the best, Dr. Johnson, and thank you for having this platform. This is amazing.
No problem. Thank you so much. Let me drop
Yeah.
it down, okay?
Thank you.
All right, now, yeah, okay. I see you. Everybody in the chat, welcome, welcome, welcome. I see y'all. Thank you so much for being here, y'all. This is the first office hours of 2026 with Dr. Johnson. Okay, new background, and I updated my stickers. Y'all like my new background, and I updated my stickers. You guys know I'm always gonna continue to improve for y'all. I'm finna improve. I'm finna improve. I'm finna improve. So I'm just trying to improve for y'all. Today we did the office hours. Thank you. That was awesome. And I saw you guys in the chat. Miss Keena, I see you. Miss Keena, I see your back is hurting. And you feeling heavy? What's going on with you, Miss Keena? Don't share what you feel comfortable sharing. Jack Crow, I see you in the chat. Dr. Berry, I see you in the chat. Dr. Henry, I see you in the chat. I appreciate every single one of y'all. Blessed Believer, I see you in the chat. I appreciate every single one of y'all. Let's Dr. Lewis, I see you in the chat. I appreciate you. I want to continue. Today we did office hours a little bit different. We did our interview first because our guest, that's a big CEO, and that's a mom of 3 kids. She was busy and she messaged me and she was like, Dr. J, I can't stay too long. I'm pressed for time. So I said, okay, don't worry about it. I got you. So I did the interview first. We're gonna jump into my trending topic. I didn't even have the time to send my moderators at my trending topic, but that's all right. Miss Keena, you laughing at me? I hope you're good. Send me a message and check in with me if you're good. I want to make fan stickers. Okay, Dr. Berry, I can help you with that. I was gonna talk to you about that. We can definitely make some fan stickers. Let's jump right into. We're not gonna stay too long. I don't want to keep y'all too long. I know we're busy. It's 2026. We planning a lot. We got a lot going on. I just want to briefly share this with you guys because this is fresh off the news. This is fresh off the press. Okay. Severe staffing shortages expected at New York hospitals as 15,000 nurses go on strike starting in New York City. Okay. This week, January 12th, that was yesterday. This was fresh off the press, fresh off the grease. The grease is still dripping on this, okay? New York City nurses walked out of 10 major private hospitals across the city on Monday. That's yesterday. I said fresh off the press, hot off the grease. The grease is still hot. It's sizzling. I want to repeat that again. New York City nurses walked out of 10 major private hospitals across the city on Monday to demand increased staffing, funding of health benefits, and protection from workplace violence, often coming from patients. Okay. The mayor, Mamdani, who was just 2 weeks into his term, joined the picket lines to support these 15,000 nurses that the New York State Nurses Association said were on strike. In quotes, they were not asking for a multi-million-dollar salary. What they are asking for is their pensions to be safeguarded, to be protected in their own workplace, and to receive the pay and the health benefits that they deserve. Okay? You know, New York City is a big state. And you know, New York City, a lot will start there, it will trickle down. Okay? Do you all think that's going to trickle down next? Okay, we love a strike, especially with the current administration we got going on. We love a strike. 15,000 nurses in New York are on strike. Mount Sinai Hospital said that the union's proposal would cost $1.6 billion over the next 3 years, with a $638 million increase in nursing costs by the 3rd year, which is 70% more than current costs. You see why I brought on a nurse? I interviewed a nurse, and then my trending topic is nurses going on strike. I'm always going to intertwine the two. That's important. It's a learning moment. I'm glad I caught this. I didn't have class in Akina. I'm glad you caught this too. It's good to see you. Y'all, this trending topic, New York is on strike. 15,000 nurses. Ain't that crazy? I'm just going to breeze through this. Ain't that crazy? 15,000 nurses are on strike. Mount Sinai, New York Presbyterian, just to name a few, all hospitals were open and continue to provide services, but they barely got nurses. And you know, there's always going to be a sick person. There was always going to be somebody sick, but just so y'all know, 15,000 nurses are on strike in the state of New York. And while you guys know, I breezed through my trending topic. Everybody, that's a wrap. I'm tired today. Okay, we're going to wrap this up. I don't even know if I did an hour. Pressure. It's a lot of pressure. I don't have no professor tips. The only thing I'm going to wrap up with saying is the next conference is going to be good. Exactly, Nini. I wonder how this would work in a non-union state. Exactly. And you know what? Start in New York. I could easily trickle down to other blue states. I hope they get everything they're asking for too. Because wasn't remember the other day when all of the artists, the actors and actresses, they were on strike too. They were on strike with the SAG, so that they can get their health care. I hope I hope they get what they're asking for. And you know what's crazy? This current administration, because they're so big on wanting the public to like them, they probably gonna do something to, you know, help them out. You see, like how the orange man came in and talking about something, he saved TikTok. He just wanted the public to like him or you know, let's not talk too much on him. Let's not be staying positive over here. Professor Tip, I don't have no Professor Tip for today. You guys, I'm tired. It's a new year. I'm planning some stuff, but the next conference is gonna be amazing. So far I have 3 guests who confirmed. I just have to work on the flyer. The next conference will be in February, and we all know February is Black History Month, so it's gonna be kind of along those lines. I'm not to give away too much because you guys know I like to surprise y'all with the flyer. Hit y'all with the flyer and be like, okay, damn, Dr. Johnson really doing some things. Yeah, I always gotta grow and I always gotta flourish for the rest of y'all. Okay. I see you, Dr. Berry. Get some rest. I will. Rest is your resistance. Rest is definitely my resistance. I'm Jamaican and I'm a Capricorn. That's a double whammy, nigga. Almost just cuss. That's a double whammy. Jamaican and a Capricorn. I don't know. Only thing I do know is work. Only thing I do know is go. Dr. Johnson, stay on go. Anyways, y'all, I appreciate every single one of y'all for being here. I appreciate all you guys for continuing to show up for me, and I appreciate all of you guys' support in 2025. Y'all supported me. Y'all helped me up in 2025 for me to continue to show up, because there were a lot of Tuesdays where I was drained. There was a lot of Tuesdays where I was like, I don't know if I could do this. But when I put this phone up and cut the camera on and saw y'all comments, I was like, oh, I got to continue showing up. So I just appreciate all of you guys for, rocking with the boy, rocking with the kid, rocking with Dr. Johnson. I appreciate every single one of you. Dr. Berry, I see you. Miss Keena, I see you. Dr. Lewis, I see you. They asking me, hold on, to do the puzzle thing. We gonna wrap this up, okay? Here's my tunes. That booty non-stop when the beat drop, just keep swinging it, get jiggy, get drunk up, percolate anything you want, call it oscillating, but don't take pity. Deuces in the chat. Okay, Blessed Believer know what it is. Blessed Believer dropping the deuces. I appreciate you. And you guys, I just dropped a new video. It was point of view when you tell people you work in healthcare, but there's no patient contact. But you have no patient contact. I find that it's important because there's a lot of people who don't know that you could work in healthcare and not have no patient contact. Surgical coordinator or surgical scheduler, revenue cycle management, healthcare marketing, healthcare educator, public health analyst, healthcare informatics. There's so many jobs in healthcare where there's no patient contact. So that was important for me to drop that video early on that I did today. Okay, y'all have a good night. The club, them want flex with us, to get next with us, them now vex with us. I'm not trying to miss nothing in the chat. Hold on, let's scroll through. I appreciate y'all using the stickers. I see you. Let's get it on till the early morning, girl. It's all good, just turn me on, girl. Don't sweat it, don't get agitated, girl. Go take anything you want. You wrapping up. I don't want nobody else to come in and thinking I'm still going on. Dr. Berry, I see you liking the live. I appreciate you. Thank you so much. Y'all have a good night. I'll see you next Tuesday. I'll keep y'all for a little bit longer. Class gonna be on for a little bit longer. So next Tuesday, I'm gonna get y'all. But today, I'm tired. I'm drained. The new semester just started. I got 5 classes yesterday. It's a day. It is a day. Showing up on this app is a job. Let's keep it a buck. Showing up on this app is a job, and showing up in the way that, and not to take away from what anybody else got going on, but showing up in the way that I show up. Once again, I'm not trying to compare myself to nobody else, but kind of in a way, but no disrespect. But showing up how I show up, it's a job. I'm coming on here being a resource. I'm coming on here sharing information. So it is definitely, my 4th job coming up on here, because y'all know I got 3 jobs. I'm a true Jamaican. This Jamaican got 3 jobs, and plus I'm a full-time TikTok host every Tuesday, 7 p.m. Miss Keena, I see you liking the live. I appreciate you. Dr. Berry, I see you. Dr. Lewis, I see you. Y'all have a good night. I'm tired. Let's wrap this up. Hey, we in the shiny. Hey, we good. We wrapping it up. Good night, everybody. Dr. Berry, 3 jobs. 3 jobs. 3 jobs. I'm a professor at 2 colleges, and I work at a healthcare facility, and I show up here, and I'm also working at a home health agency. That's 4 jobs. I'm downplaying myself. 4 jobs. We wrapping it up. Have a blessed night. Dr. T, I see you here. I appreciate you. We gonna talk. Everybody have a blessed night, okay?
We at the party. You can bring a shorty. But we go rolling in the party. Party's going